you, Steve. First of all, thank this outstanding body of people, group of people who have taken the time, and I'm sure others are going to call in to join us. This is our second meeting, Black Springfield COVID, Reverend J.P. Morgan and Doris Harris. I just want to, I know you have an agenda, Reverend, and I just want to say a couple things.
Please.
I just think 3 points that I want to make is that I think at some point in time, and we'll be guided by the commission in terms of the language that we use to get some correspondence out. I think we need to appoint a person from Western Massachusetts or Springfield to the state COVID-19 advisory board. There's only one person. And the other point, addressing increasing demands for testing, increasing testing sites in Springfield and Western Massachusetts. And the last one, and it's already started, ensure fair and equitable distribution of vaccinations for Western Mass and Springfield. So those are 3 points. I think those are going to be highlighted. There's other stuff in terms of remote learning. There's a whole host of issues and situations that this body, I know it's a lot of work, and I want to commend you and thank you again for stepping up to the plate, to being a voice for the voiceless. With that being said, our distinguished chairperson, J.P. Morgan, it's in your hands.
Thank you so much, Representative Williams. I appreciate certainly for years all the work that you've been doing in the community, and thank you for this idea and helping to pull this incredible body of people together. I would be remiss. I'm from church, so I would be remiss if I did not give respect to Commissioner Helen Carlton Harris, a consistent and hard worker, lover of people of the city of Springfield. And for years and years, she worked side by side with my dad in tackling a variety of issues. And so happy to have you here with us on this call in this meeting. And to all of you, just grateful to be here. I know our time is limited, and so there are a couple things that I picked that we decided that we wanted to start off talking about tonight. These will not be the only issues that we will address, but I want to, a couple things I want to talk about tonight. I want to talk about a plan for distributing PPE supplies. I want to, and information. I'm looking to get agreement on the need for us to have a webinar that will, in addition, feature people that look like us. I'm looking to get agreement on putting together a PSA. And this also has to do with not just what Ms. Harris said, but in our last meeting, what Ms. Ayanna Crawford talked about in our last meeting. And then maybe if we have time, I'd like to pull together the possibility of when we may be able to meet again. So let's see what we can get through and what kind of discussion that we can have.
Model that's being used at Quinsigamon Community College that we use as a starting point.
That was someone that came. Okay, Bishop.
Yep.
With your permission, can we diverse for a couple minutes and let Commissioner Carlton give us a overview
please.
of what's going on in the city? I thought we missed if we didn't.
Please,
Commissioner.
Certainly, I think as each one of you know, the city of Springfield and the Commonwealth of Massachusetts and the nation is in a surge. I will just briefly tell you that the week of November 22nd, there were 675 cases. The week of November 29th, and I'm talking about Springfield, there were 1,168 cases. We had an increase of 493 cases over that previous week. Last week, we had 1,333 cases, which was a slight decrease of 135 cases. 41% of those cases are 30 and under, 33% were 31 to 50, and we're talking about age, and 26% were 51 and older. I've had an opportunity to speak with Bay State Health. The hospitalizations and deaths continue to rise. Last week, we had 9 deaths in the city of Springfield. 3 of those deaths were from the African American community. Last week, the Black African American community, the number that we had of positive cases, 25% were from the Black community. And that is, really not a true number, because we have 33% that was unknown. And so some of those unknowns obviously will carry over into our community. So we are in the process. Sunday of this week already, we had 132 cases. Monday, 170 cases. Tuesday, 145 cases. And on Wednesday, we had 121 cases. So we are continuing the challenge around the surge in our city. We're working closely with the Springfield Public Schools to make sure that we are giving all of the information they need in terms of returning our children to school. Let me also say that the zip codes that are predominantly impacted are 01108, 01109, 01104. Those are the zip codes with the largest population, but they certainly are the zip codes where we're seeing the most numbers in the city. And so it's important just to recognize that November was the largest month that we've ever had as far as positive COVID-19 cases are concerned, which was 2,995. We've never seen those numbers before. So the surge continues. What I'm in the process of doing for State Rep Williams, as well as the chairs, is just pulling out the data around the Black community so you can isolate and take a look at it based on what you need to see as far as the prevalence in our community is concerned. But we definitely know the concern that we all have right now, and I talked with State Rep Williams about this, is the vaccine. And having this group think about being the trusted voices that help individuals understand how important it is to consider the vaccine when it's ready for general public. That won't be until between April and June, but I have had conversations with individuals in all communities, but certainly in the Black community, who are very skeptical about taking the vaccination and really do want to hear from trusted voices. I think I told you that trusted voices are not only the medical community, but certainly the pastors, the faith community, community-based organizations who are willing to go out and say, yes, this vaccine is safe and we recommend it. So I'll stop there. I'm happy to answer questions at any time. Thank you for the opportunity, State Rep, and to your chairs, Doris Harris, and certainly one of the wonderful people in my life. You know, I loved your dad. He would call me all the time just to say, Helen, hang in there. I got you. So thank you very much.
Thanks, Commissioner.
Thank you. Thank you so much. I'm so glad that you are working on pulling out information regarding our particular concentrated population. I was going to ask you about that. But you answered that question already in your address. Thank you so very much. Yes, go ahead, Jeffrey. Go ahead.
Hello. Oh, thank you. Yeah, we are monitoring the chat. That's great. Commissioner, first of all, how are you? Second of all,
I'm well, thank you.
Thank you. I did want to ask if there was any sense of the incidence and how people or how folks in Springfield at large are contracting COVID-19. Do we have a sense from the tracing that it's our frontline workers, the people who are working in our stores at the front line? Is it small gatherings? Are we getting a sense of that at this point?
Yes, thank you for asking that question. It's an excellent question. Yes, we do know based on our contact tracing that it is small gatherings within households. What I am also going to give you is a map of the city so you can take a look. There's no names, no streets, but you can take a look at zip codes and see the clusters. And what you can see from those clusters is that it is small gatherings and sometimes large gatherings, but potentially it is within households and individuals on streets, individuals in neighborhoods, individuals visiting each other. It is not tracing back to restaurants. It's not at this point tracing back to gyms. And so there are some, so we ask individuals clearly, to your point, to stay, in your household gatherings at this point and not venture out. So to your point, again, it is small gatherings in households and indoor settings where we're seeing the surge. And that's to be expected, getting darker sooner. People are more indoors, but thank you for the question.
Answering, appreciate it.
Hello, Commissioner. This is Lamont. Always welcome to hear your voice, and hope all is well with you. What I like to say is one of the questions I did have is how do we go out and educate people in our community to feel so that they can feel safe, first of all, pertaining to the vaccine, and then what is that we can start talking to people, because I'm hearing you say that that you're hearing that it's safe. If you feel that it's safe, and look like this is one of the ways that we will have to kind of stop this surge and get people try to start working on people not having this COVID. And my other question is also, if we're vaccine and going back, I want to just back up with testing. How can we also maybe possibly talk a little bit more about mobile van, and how can we get people that are not able to use their vehicle to get to the sites to get tested, or whether it takes a while for them to get to their health center? How can we help and support people in neighborhoods that's where they can probably come out their house and be tested in their community, so that we can also know that people are starting to get tested a little bit more. If there's funding around, I did see something from TD Bank, but in Bay State, but I'm not sure how far that is going to be going, and how many vans that we can possibly do, and what it would take to get a community effort to get more vans and testing out there to support that.
So I know that we have limited time, and I want to give this back over to the chair. But let me quickly just say the vaccination, well, the first thing we have to do is educate ourselves. We need to be comfortable that the science is what we believe it is. And so unless we educate ourselves, we can't educate others. So I would recommend that we collectively look at the science and be comfortable in what we're seeing. I've done it, but I would recommend all of us take that opportunity to feel comfortable. And then we can talk about mobile testing. Some of that is going on through AMR, but I'm happy to have a more targeted conversation with you about the strategy other than AMR at Eastfield Mall, where the small location testings are hopefully happening. So I'm going to stop there and give it back to the chair. So I know there's an agenda, but I'm happy, if you want to call me, I'm happy to have any conversations at any time.
Thank you.
I'm just going to jump in, but it's absolutely, we have an agenda. That's on the agenda. But Frank Robbins already reached out to us to talk about mobile testing. So we're going to get into that. But right now we have an agenda, and we're going to stick to the agenda. And then I think Reverend Morgan is going to break down the subcommittee groups at some point in time, and folks will be able to do some work in other areas.
Right. I just want to ask one more thing. Breakdown of ages, will that be in the map or the information that you give us? Commissioner Calden?
I'm sorry, I muted myself. Yes, I will break down the ages by race. I will have that done for you as well.
Okay. Thank you. Thank you. In dealing with looking at how we're going to get information out, I think first and foremost, since the vaccination is not going to get to us until late spring, early summer, fingers crossed. I do think in the meanwhile, we need to be concerned about social distancing. I think we need to be concerned about wearing masks and even the proper way to wear masks. And I'm going to ask Ms. Doris Harris to just take a few minutes and talk a little bit about the plan for distribution of PPE supplies.
Okay, yes. Good evening, everyone. We will be collaborating with Stone Sew, and we will be at a Black Wall Street event at Eastfield Mall on December the 30th to distribute out the PPE equipment. We will be giving out masks as well as hand sanitizer, and we will have, they will be in a bag, and we will include it in the bag will be a message from CDC. It will be an illustration with how to wear the mask, washing your hands, as well as social distance. That's the beginning and start of an event that we definitely wanted to do. We feel it's going to be a very vulnerable time with New Year Eve approaching, as well as it is Kwanzaa. So it's a way to interact with the Black businesses as well.
Thank you. Thank you, Ms. Harris. So that's going to be on December 30th. One of the things I was thinking of is how often do we need to distribute supplies, and how long are we possibly looking at doing this? I think that in addition to the December 30th date, I think it might be a good idea to have another distribution and take advantage of a major time, possibly during the MLK weekend. And that would be 15th, 16th, if I'm not mistaken, according to my calendar.
Yeah.
Yeah. And what we could do is we could do a major outside event. It could be a drive-through event where people wouldn't have to get out of their cars. In fact, that's when I saw Ms. Harris working, and we talked a little bit about this. We talked a little bit about this COVID-19 coalition, and somewhere that would be in the zip codes that Commissioner Carlton Harris was defining. So that's another thing that I would like to see happen in regards to December 30th. And as Ms. Harris said, because, people may be gathering for something during close to New Year's, we're trying to help people to be as safe as possible. But I think that is something that, in addition to the December 30th, I think that January 16th on that Saturday is something that we really could do, and we could really make happen.
That's first of all, what's the time on the 30th? Is there a time on it?
Yes, it's in the evening. I believe it's from 6 to 9.
6 to 9?
Yes.
Okay, Kwanzaa, it starts at 12 o'clock, but you're saying we're doing the mass 6 to 9. Here's Bishop on that. I think this group, we've been doing mass give outs with the Brethrens and the IOTAs and Black Men of Greater Springfield. There's never two. We just did one with the Brethren. We just gave to the blind community, the Visionary Club. If we, in conjunction with Families Against Violence, that's a group by the Bishop Bayman's church. I know they have access. We're about to get 20,000 masks for Springfield. Them through Boston, through us working with folks in Boston. We're going to have enough masks. I'm of the opinion that we can't do too many of these giveaways. And we have to realize and understand that we have to get in the belly of the beast in the valley, which is in Mason Square somewhere, whether it's Spanage, Stone Soul Building, your church, Reverend Swan's church, and make it easy for folks to get access to masks and sanitizers. Because I'm going to tell you, in the community, you can look, Commissioner Colton, sometimes you look at people, you know, they've been wearing that mask for a long time. They could have been wearing that mask for a month. I mean, we might think that it's, you know, $2 for a mask is not a lot, but when you don't on a fixed income, it becomes a whole lot. So I will help with Reverend Morgan and Doris. We'll get masks. We just got to, I think the best thing for us to do is coordinate with other groups when they do these give outs to give away. We've done them. We did the cancer thing with Doris Harris up there at Panache. It was masks involved. We can't have enough masks. And what we're going to give is N95 masks. We got N95s coming in to give to the people. So I'm working on that now. Within the next couple of weeks, we'll have enough masks to give out to our people because, as Commissioner Colton said, they're going indoors. It's dark. People are inside. Small gatherings. People are partying. They're not having the masks on. Folks, you got the motorcycle building. You got Bergen. You have all these congregate housing. We have to understand this is real. This is Commissioner Carl. I don't think we look to the statistics. No one, I'd shake my head. This is serious stuff. And it's killing people. Bishop, I'm done.
Oh, okay. But you are right. I'm seeing rise. We had no COVID cases in our church. And now we have had 2 families. And this was since the last holiday. We've had a rise in numbers. And, you know, we're social distancing, but we're bringing that number back down to 15. We can't even do the small percent that we were doing. So, and that's in an effort to keep people as safe as possible. And, you know, so so many more people are getting COVID that I wouldn't have even considered. But that's, to your point, Representative Williams, that is really happening. And I talked to someone in the community, one of the funeral directors, and they told me that they had COVID at the beginning of November while the election was going on. And this is what, December 17th. And so it was yesterday and Tuesday, and they mentioned to me that their breathing has not fully returned yet. So it's serious. It's really serious. And so this is why I think that the distribution of the PPE supplies is something that we sorely need. So thank you, Ms. Harris, and thank you for letting us know the time. And I do want to, but I really like getting together with some additional organizations to make that happen for the 16th. So with all of this in mind, when you talk about getting the word out, when you talk about messaging, that becomes a part of what we're doing. I really would love to have look at doing a PSA, because once again, we're going to talk about us being the trusted voices. Then we need to make sure that we are getting a consistent message out in regards to how this is spread, in regards to the things we've been doing to continue to do. And once we finish, do the research, as Commissioner Carlton Harris suggested, then we will be able to talk intelligently about the vaccine. We talked a little bit about that And Miss Ayanna Crawford was talking about utilizing social media and really getting the word out to young people. Yes, okay. Thank you. Flyers, okay. And information that we can give. Okay, all right.
Beautiful.
Thank you. Yep. Thank you. Thank you so much, Commissioner Carlton Harris. I'd like, if she would, Miss Ayanna Crawford to talk a little bit about that. Is she here? I'm trying to see. Or to elaborate on that. I don't see her. Maybe she had to go. Maybe she had to go. Okay. That's okay. I want to go back up to, and I would love to get a couple people to work on putting together the event for the 16th. I know Ms. Harris is already going to be involved. I know Bud is already going to be, Representative Williams is already going to be involved, but I'd love to get a few more people to help work on that. Don't everybody raise their hand at once.
All right, if I could add something quickly. On
Please.
Saturday.
Yeah, please.
On Saturday, MOCA, the Deborah Hunt Center, and the C3 program would be distributing coats and gloves and scarves and Christmas stockings. We spent all day yesterday stocking at the Panache. That would be a great opportunity for us to distribute some PPE.
On Saturday? Okay.
What's the time on it?
Yeah, what's the time?
We'll be there from 12 to 2:30.
Let me make a correction, Mike. I'm sorry. This is Lamont. I just got off the phone with the secretary for the C3. She said it starts from 1 to 3, but it'll be getting set up starting at 11:30 with tents to make sure the parking lot. But thank you, Mike. He's exactly right. We'll be out there distributing stockings, stuffers, and if there's information or anything can be given, it'd be a great opportunity for people to ride through and get either anything that you want to give out at that point in time, if not just information for upcoming events. Thank you.
What parking lot?
Behind
Panache. Panache, where Doris was at. It's very popular around Springfield.
Hey, that's a good.
We have some PPE. Lamont could come and pick it up.
We could also, at the YMCA, we could make.
My wife volunteered to work on that committee.
Okay.
And I think Andrew K would be a great candidate for that too.
Who else?
Andrew K.
Okay.
Willette Johnson, Mary Worthy.
I'll work on that committee.
Mary Worthy.
Okay.
I'm sorry. What was that committee that was just announced? I'm sorry, JP.
So this was the committee. Go ahead.
Ayanna's back.
Yeah,
okay.
I got kicked off.
Okay, that's okay. That's okay. So we were just talking about distributing PPE supplies. And this would be, we're doing tag-ons on December 30th with Stone Soul and the Black business community. We're also doing tag-on with MOCA, who's doing an event on Saturday, passing out stocking stuffers, et cetera, from 1 to 3. And then we're talking about a big event during Martin Luther King Jr. birthday weekend on that Saturday, which is the 16th of January, once again in another drive-by effort. So nobody will have to get out of their cars. We do have a number that we can call for information from Commissioner Carlton Harris' office. So thank you so much. That number's in the chat. That's Shirley.
Reverend, you wanted Ayanna to address us in terms of her idea for that social media thing?
I did.
Yes, sorry, I got kicked out.
He said not sure why Ayanna dropped off. That's okay. Technology is great when it works.
Yes, yes.
But yeah, I wanted you to elaborate a little bit more on what you were talking about last week. Not last week, but last meeting in regards to reaching out to young people. There's a significant population that's part of the surge that Commissioner Carlton Harris talked about. You talked about using social media, and the reason why is because I'm concerned about putting together a PSA.
Mm-hmm. Mm-hmm.
So I just wanted you to elaborate a little bit more on using social media to reach our younger people.
Absolutely. Thank you so much, Reverend J.P. Morgan, and of course, Rep. Williams, for this opportunity to participate and be a part of this group of wonderful individual leaders in our community. And so the idea around social media that I had certainly thought about was just to create some sort of buzz, if you will. And I think with all the things that are so in terms of communication and clustering things, it's always good to utilize social media to give that buzz, to sort of brand or to market or to inform the community, especially our young people, because we know they use that platform in terms of communication, right? And so the best way to get to young people is really through social media platforms, whether it's TikTok, Twitter, Facebook, Instagram, or what have you. And I think creating some sort of campaign around what this coalition is and what the importance of what we're doing is, so that they can pass that information along to their peers, right? And so certainly looking at that, and I think we can certainly come up with some hashtags, some very buzzwords that will really sort of, kickstart this whole coalition, this whole sort of branding of awareness, which is really ultimately education, right? And so we want to, in addition to bringing awareness, we also want to educate our young people in terms of their activities, their behavior, so that we can certainly get a handle and support, what, and I neglected to recognize our commissioner, Helen Carlton, for her work. And so that she's not doing this in sort of a vacuum, that we are collectively helping to also penetrate those younger communities that really need to be more thoughtful in terms of their own individual behavior. And I think utilizing those vehicles of social media would really certainly help this group and certainly help to bring about awareness and education to our young people and to our older folks too, because a lot of us utilize social media as well. Those of us that are, 30 plus, we use that vehicle too. And so I think just creating some sort of campaign that will really be catchy, whether it's videos, whether it's just some social media posts, whether it's a deliberate banner that we can creating a Facebook page, whatever it might be, that will really sort of kickstart this whole coalition, really sort of get us in the faces and the places and the spaces that we need to be, so that we can really sort of, make more people aware of what we're doing. And so that was that piece. And then the other piece that you mentioned in terms of the PSA. And so, of course, we have Andrew here from WTCC, I think certainly doing something, that we have a text, we have a script that we are, putting on the radio and coming up with sort of those powerful, impactful words that will trigger the thoughts and the minds of folks saying, I really need to think about this differently. Perhaps maybe my behavior is not correct. And so maybe I need to reconsider some of the things that I'm doing, because the numbers are increasing, because the cases are increasing. And so I think with awareness, education, and doing some sort of PSA around that would be very, very beneficial. And so creating that platform would be advantageous at this point as we create some sort of way that we're bringing awareness. And also a billboard, people utilize billboards all the time. Lamar is a great company, and they're all over the city, Western Mass in particular. And so even creating a billboard, with our campaign slogan, our campaign, whatever that might be, and putting that out there too as well, and so those are sort of my thoughts, in terms of that. Thank you.
I think she just named herself co-chair that movement, chairperson to lead that situation.
I am in agreement with you. If she would, I wouldn't want you to do it by yourself. But certainly everything that you said was what Bud, Doris, and myself have been talking about. All of that, the messaging, and bringing that awareness and education, the branding of the Springfield Black COVID Coalition. And yes.
Reverend, just a quick, I heard what Ayanna said, and this ship may have already left the dock, but just to put it out there, the children in Springfield who are doing the remote learning are on those computers every day. The young people using something called Schoology, and the older children, I'm not sure. But is it possible for us to do a PSA in the midst of that Schoology, or in the midst of the platform that the high school students are using? I don't know what kind of partnership we would need from the Springfield Public Schools or authority that we would need from the school committee, but the children are on those sites Monday through Friday. Wouldn't it be nice to have a PSA that talked about this coalition and reminding people of and then the kids would say, "Mommy, look what's on Schoology." And so if that isn't already being done, and like I said, that ship may have already left the dock, but just as a suggestion.
So let me jump in with that. So as I understand, how Schoology has worked, and some people are fans of it and some people aren't. And so utilizing some mechanism within the Springfield Public Schools to partner with them in terms of getting the word out would be absolutely the right thing to do. And so whether it's Unified Classroom, Schoology, Seesaw, whatever it might be, absolutely. And so if we could get authorization and or an opportunity to have that, because I believe we have, over 56,000 students in our Springfield Public Schools currently right now. Someone can certainly give me that number. I think would be great. And so if the superintendent of schools, if the school committee could certainly agree to something like that, I think that would be awesome. Because again, it's awareness and education. And so where are our children, as our former school principal has stated, they're on these social media platforms, Schoology, Unified Classroom. They see this every single day. And so absolutely, even creating, and I think I would even go further, Ms. Johnson, and say, why not create a emoji classroom, right, about the coalition, and we be those emojis creating the conversation to educate the children about this coalition, that we just create that platform. Perhaps we could do that. So we could go into the classrooms with our emoji into the Schoology and say who we are and what we represent, because we have second steps. We have that social emotional classes that come in. Our school counselors do that all the time. And so perhaps we can partner with them and do some of this social emotional awareness education piece too. So I certainly agree with that. And certainly perhaps connecting with those school psychologists and counselors to create a emoji classroom.
Okay, I fully agree. So with that being said, I think Reverend Morgan and myself and anyone who's interested, we're going to call a meeting with Danny Warwick and go talk with the superintendent. Mm-hmm. You have to be part of it. I can't talk that language you just talked. I'm going to tell you. Yeah, we'll work on that with Chairman Morgan. We'll get a meeting with Danny, and then we'll get a meeting, a Zoom, and then we'll call people in, and we'll. It's a great idea. I mean, that's you folks are so smart, man. You guys making me feel bad over here, Will. Diana.
I'm just glad my brain still works, Representative.
No, that was a really great idea. Absolutely.
Okay.
That is excellent.
I'll be on that tomorrow morning. I'll be making calls in the morning on that one.
Okay. Fantastic. That's great. So that is a great start to beginning to get our messaging together. I think we're all set with our subcommittee for the PPE supplies. At some point, I'm also interested. We also talked about doing some kind of webinar. I know there are some webinars going on, many that I've been on, and some I've been invited to. I've been on Bay State. I mean, good stuff. But everybody I talk to, how do I want to put this? Everybody, when I was a kid, I got a great kick out of. I loved so much music growing up, and there was a group called the Osmonds, and they were fantastic. But there was another group called the Jackson 5, and I probably appreciated them because when I saw them, I could see myself on stage singing. We hear a lot from the medical community, but we don't always hear enough from people that we could see ourselves with stethoscopes. If I was in church, I'd say it's very quiet. So what I'm interested in doing, I'm interested in putting together a webinar with not just the usual subjects with somebody else standing in the background, but to actually have a conversation with people that look like us about us. I can't remember the name of the doctor. He was from Boston. And one thing he was talking about, and this even goes to what we're going to need to deal with in regards to this vaccine. He was talking about the fact that it's difficult for people to come into our neighborhoods and test us for different vaccines because of things that have happened in the past, because we're so mistrustful. But if you talk to our doctors, they will tell you that the medical community does not know enough about our physiology. They do not know enough about our physical makeup in order to prescribe things that will help us. Because as a race, there are some differences that we have that other ethnicities don't necessarily have.
True.
Amen. So,
Amen.
yes, go ahead. Principal Worthy.
Yeah, I was going to say in speaking about that subject, I don't know if you realize that Dr. Shirley Jackson Whitaker is doing a weekly session on Facebook.
Okay. Okay.
On Sundays, I think it's around 12 noon or so. But again, I don't know if that's an individual that we might may be able to hook up with, because she is speaking directly to that, as people of color and COVID and the like. So again, that's another name that might be willing to participate.
That's a good.
Well,
I deal with the Minnemoka. We've done webinars before. Lamont Scott and Jeffrey Markham. They have a whole list of Black doctors. Dr. Latham. We got doctors out of Boston. There's a list of them, And we've done webinars with them. I think Doris will tell you, she's been involved with them, and Commissioner Colton knows them. We can put together some doctors, I believe people of Black and Brown look like us, to in a webinar. And Doris Harris, she does webinars herself. She's excellent at doing.
Yeah, I just want to say, Representative and Bishop Morgan, that I will be doing in January, I will be doing a COVID webinar. I'll be the moderator with the National Black Nurses of Western Massachusetts. We did a wonderful one on breast cancer in October. And what we did is we utilized nursing professors who were Black from AIC and the University of Massachusetts to talk. But then what we did is we actually had breast cancer survivors. And I was leaning towards having something like that. Bishop and I and Representative have been talking consistently. And I'm sorry, I'm just announcing it now. We were, talking about that. But they're willing to come forth. I also have a wonderful doctor who is a Rose, Dr. Babatunde Thomas. So you're right, Representative. We do have listing of doctors. Dr. Whitaker is excellent, but we will have that. And I just want to say on January the 13th also too, Dr. Andrew Boulder will be on my show to answer myth and facts about COVID. So we're moving along, and I know that Bishop didn't want me to talk too much about this.
No, that's
okay. But these are the things that we've been working on. These are the things that we've discussed, and we wanted to make sure that we were targeted and we were meeting the needs of the coalition as well as the greater community at large. So these are some of the things that I was approached. People had approached me and asked me would I be willing to help coordinate this. So I'm just moving along.
Yeah, and I'm gonna volunteer Lamont Scott, because in Mocha he has great contacts with a lot of doctors, because we do it for prostate all year long.
Right.
Exactly. We got over. And hi, Mariel Holloway. Thank you for joining us. Thank you, my sister. We got over 30 people. What a great turn. I want to thank you, folks. Really, really, really.
Would you volunteer before, Bud?
I wanted to
heard you back there.
If I could stress, we've got no shortage of brilliant, beautiful Black and Brown doctors, virologists, and other scientists who can speak to it. But I don't want to downplay what thought leaders in our community, such as yourselves, mean to this effort, right? So, we want to, the trust is the biggest factor that we're talking about right now, in particular when we're talking about vaccination. And, doctors, but they're a part of that system, as brilliant as they may be. But if we can get that information relayed to us and to you folks in a way that's digestible, and then you can carry that forward, I think that is another layer of trust that can quell some of the fears that people in our community rightfully have. So I don't want to, we need those folks as well, but people in this room, the leaders in community are important. Leaders of church and of industry here are important as well. I just want to make sure you guys know your power.
Yeah, no, we're not saying, that's not what we're saying. What we're saying is that we're professionals. They're the scientists and they're the doctors. We got to have a coalition.
That's what I mean.
Yeah, when we go forward.
Let's have everybody at the table.
I mean, the Black COVID Coalition in Boston, they have doctors and everybody with them. But I think the point that we're trying to make is that that's why I'm so happy that Commissioner Colton joins us. We want to be factual with this.
Right.
Present information. Absolutely. We got to be on point. It's not my opinion of something. This is fact.
Thank you.
So I think it all makes sense. This is a great idea and some good stuff. We got some work to do, but this is important work, man. You're absolutely right, Mr. Markham. And I think, Jeff, you should work with Ayanna on that messaging thing for young folks to get involved with that, because I know you're good at that. So I want to ask you to join that committee too.
Yeah, I'll be happy to connect with Ayanna. Go way back.
Thank you. Thank you so much. I purposely started general, and I was waiting for somebody to jump in and say, well, we've got Dr. Whitaker we've got, you know, Dr. Such and Such, which is what you did. And so I appreciate that. This is, I believe we are off to a great start. And like Representative Williams said, we've got our work cut out for us. And so we need to, I don't know, I think what I want to do
Reverend,
is, yeah.
Just one last thing, because we haven't really touched on tonight. We got a lot of educators with us, and it'll be a separate track, basically, maybe the third or fourth rail that we deal with. But there's an important school committee meeting tonight at 6 o'clock on focus.
Right.
The school committee is going to decide tonight whether or not to do remote learning, virtual, whatever they're going to do. But I do know that we're going to need these educators to really work the school for us. It's like an ad hoc committee. Basically, they can do a lot of the work day in and day out because they deal with this. And I know there's a big concern about the digital divide within our community as it relates to COVID-19. So I just don't want to forget that.
Definitely. Definitely. And thank you for bringing that up.
Reverend Morgan, Dr. Renix.
Yes.
Hi.
Yes, ma'am. How are you?
Good. I've just been listening, and I came in a little late, so I know that Commissioner Harris had mentioned the areas of concern.
Right.
So I don't know what she said per se, but I was wondering, and I haven't heard anything about our colleges and what are we doing on that level with the students. We have one college that's right there in Mason Square, and it has a high majority of Black and brown students. And I'm around that campus a lot, and I see students not doing what they're supposed to do. And they are also out in our community. So have you had any contact with the people at the colleges, the upper echelon of those people, and to see what they are doing as far as the COVID?
So thank you for asking that question, Dr. Renix. It's good to hear your voice. We are in constant contact with the executive committees or the presidents of the colleges. As you know, Springfield College has shuttered for the most part, so their students are not on campus for the most part. AIC is hybrid on many levels, Western New England as well. I can tell you that most of our infections are not coming from the college community. I know that because we get the addresses, and Alden Street is the address for Springfield College, State Street for AIC, and then Wilbraham Road. But the majority of our cases are not coming from the colleges at this point. But there are a few, but the one college where we had a cluster, which was Springfield College, that college did for the most part shutter their educational institution, except for some students, a few students that are still on campus. But again, let me also say DPH does have a website that looks at each college and gives you the data around the positive cases on college campuses in the Commonwealth, and each one of the colleges in the city of Springfield have a website as well where they should be reporting their positive cases as well.
Awesome.
Thank you.
Thank you, Commissioner.
Awesome. Thank you, Commissioner. It's 4:54. We got to wrap things up. Focus came on the chat and said they need to pack up and go.
They got that school committee meeting tonight.
Yeah, they've got that school committee meeting tonight. Yes. Next meeting. Today is a Thursday. I don't know. Perhaps we could look at either maybe either the first or second week in January.
No, if you're gonna do that January 16th thing, we're gonna have to meet before then.
Well, okay.
I mean, I'm just throwing it out there for the group to
So,
decide.
well, I'm available anytime after 4 o'clock.
What about the last week in December sometime?
You want to do?
It's after Christmas. I mean.
Okay.
We got the 30th. We got the thing at what Stone Soul. That's the only thing I see on the agenda.
And that is that, and that's in the.
That's a Wednesday. That's 6 to 9 at.
So we could possibly meet before that.
Yeah, Monday or Tuesday. For me, I'm just trying to get. I know if we meet that week, we'll have 2 weeks to really pull everything together. Unless you want to do an ad hoc thing with a few people before the general body meets.
Either or.
We'll be talking anyhow, but.
Yeah. Either or would work for me. I don't know, what does the last week of December look like for everybody? Or either the first week in January. If we meet with the general body in the first week in January, the ad hoc committees could meet prior to that.
Right, exactly. There you go.
And so, maybe January 5th?
Yeah, sounds good.
Tentatively? Let's look at January 5th tentatively.
4 o'clock?
4 o'clock. And then let me send a follow-up email.
Yeah, right. But prior to that, you're going to have Ayanna going to be working with Andrew Cade on something with Markham, and then we got then we're going to be working with the school department, and you got the educators working on some other stuff. So everybody's got some work to do, and then we can pull it back together. Andrew Cade on the public service announcement and stuff.
Right.
Yeah, we're working on the 16th exactly. You're right.
Yeah.
Yep.
Okay. All right.
All right, Bishop Morgan, I have a question before you go. Is there any way I could get that PPE equipment dropped off at Deborah Hunt so I could distribute it Saturday?
What are you talking about? What PPE equipment?
Some masks to give out at the Panache on Saturday.
And we're giving them out on the 30th with Stone Soul.
If you give me a number of how many masks you want and informational flyers, if you call Shirley, the number I put in the chat, you'd have to give concrete information and numbers. We're happy to help with.
All right, well, we're giving out 20. We're giving out 200 stockings. So if I could get 200 masks, that would be great.
We'll give you 200 masks, 200 flyers to put in. We have Spanish, English, and Vietnamese. So if you want to help me with the language preference, happy to do that. And please call Shirley and we'll get those packages together for you.
Thank you very much.
David, what's the time? David, what's the time of that again on Saturday? Give us.
The time of it is 1 o'clock to 3 o'clock on Saturday at the Panache.
Okay. But they're setting up at 11:30, right?
Yes.
Set up at 11:30.
Yes. Helen, I'm managed. That's my buddy Shirley. So between David and I, we'll make sure we get in touch with her and see if we can get that stuff. We'll make sure we can get that stuff up there, and I can check in with you tomorrow if I need to. Maybe we can have something ready and someone can bring it out, and I can make sure it's all set.
Absolutely. And so we will. You will pick them up. We'll get it ready, and you will put them in the stocking. So we're happy to do that.
Thank you.
Thank you very much.
Thanks, Commissioner.
Thank you, Commissioner Carlton Harris. Thank you, Mr. Edwards, Mr. Scott. Thank you, everybody. Administrative. I was getting ready to give you a church title. I was getting ready to call you administrative assistant. Representative Williams and Ms. Harris, and to all of you who are on the call, I want to thank you so much for being on the call, for being part of this coalition. We've got some great work to do, but it's a great work. I want to thank you, all of those who are on the committees, and I'm just going to take these notes here, and I'm going to put them in a form that makes sense and is legible, and so we just remember who's on what committee, and then we'll be able to go from there and work out. Committees can work out, ad hoc committees, when they're going to meet.
Beautiful. Great turnout today, gang. Great turnout.
Beautiful.
Thank you. Thank you. Thank you. Thank you.
Thank you all so much. Listen, I want you all to have a Merry Christmas. Happy, look at that. I'm loving the tree. I'm loving the tree. And let's please spread the message of people social distancing. I had a Zoom Thanksgiving, but I feel I had a safe Thanksgiving because I didn't catch anything. Just me, my wife, my kids. And my wife is not a maker of turkey, but we had some really good fish. That's my mother-in-law's job. She makes the turkey. My sister makes turkey, but we didn't go over there. So, but please, I'm asking that everybody be safe and continue to spread the word to all of our people, just to keep it real, because we don't want anybody sick. We don't want anybody sick. And soon enough, the vaccine is coming, and I think a year from now, it'll be a much better conversation.